Hello, everyone. Thank you for joining this month's webinar. The topic is Exercising Through Injuries. My name is Dawn Cuck, and I'm a health coach with Orthis Health, a master's degree in exercise science, and I am a certified strength and conditioning specialist, and so it is my pleasure to provide this webinar and this information to you. This month's topic, what we're going to cover is, evaluating your injury when it happens, self-treatment of your injury, when it's important to stop self-treatment and go see your doctor, specific guidelines for or recommendations for safely returning to exercise or your sporting activity, and ways that you can stay active during your injury, and then in the future, how to speed recovery time should you get injured again. So an athletic trainer is really an expert in injury evaluation. If your injury happens at a sporting event or a competitive competition of some sort, it's likely that there is an athletic trainer on site. So ask to see one when you get injured. If not, some important information can help you communicate better to other medical professionals to better help you with your injury. And also recommend whether you should call your doctor or go see a doctor immediately. First, what were you doing when you were injured? There's some injuries that happen in very common ways. So this can be a very valuable information. And also, when you were injured, did you hear a pop or some other sound at the time of the injury? So if you heard a pop, it could possibly be a ligament or even a tendon that tore. One example is if your foot was planted and you were pushing off and changing direction and you heard a pop at that time, you likely tore your ACL ligament. So that's just one example of why this information is helpful. Also, can you pinpoint or point with one finger to where it hurts? Or is it more of a general area or pain that you can't necessarily pinpoint? The location will definitely help narrow things down. Is it painful when you touch it? Or is it painful all the time? And how much on a scale from 1 to 10? So if you have a lot of pain, that's a good reason to go see your doctor. What movements hurt? So does it hurt when you move it? And if so, what movements? So maybe flexing or extending a specific joint. If you have pain with movement only, but not, when you're static, it could very well be a muscle or tendon that's injured. And then also, what movements are limited? This can be due to swelling, but sometimes there's other reasons why maybe your range of motion would be limited. So, what specific movements are limited is helpful information as well. So for any acute injury or new injury, it's imperative that you begin treatment right away to avoid further injury or damage to the surrounding tissues. Whether you plan to try to treat it yourself at home or go see a doctor, start your self-treatment right away. Rest is very important. If you've injured a foot or ankle or knee, by rest, I mean take weight off of it. Rest the injured area. A crutch can help you do this. If your right foot or ankle is injured, use the crutch on your left side and vice versa. And also reduce your regular activities that can affect that injured area until you can have it evaluated. Ice helps to reduce swelling. If left untreated, the swelling can actually cause more damage to the area over time. So put an ice to your injured area right away. Leave it on for at least 20 minutes. 20 minutes on, 20 minutes off is a good rule. Try to ice for 20 minutes at least 4 to 8 times a day, especially when the injury is new. And you can also use a cold pack. You can use an ice bag. You can use a plastic bag full of crushed ice wrapped in a towel. Take the ice off again after 20 minutes, and the reason is to avoid any cold injury. And you can also ice a small area by freezing water in a Dixie cup, maybe with a popsicle stick inside of it. And this is an ice massage. And if you do decide to do an ice massage, you don't do it for 20 minutes. You only do it for about 8 minutes because the direct contact with the ice can cause, cold injury sooner. Compression is important as well. And by compression, I mean putting even pressure on the injured area to help reduce the swelling. So you can use an elastic wrap, if it's an ankle or a foot, a special boot or air cast or splint, something that your doctor would recommend, an ACE bandage. But you can ice and put pressure at the same time by using an ACE bandage and wrapping it around the bag of ice, say, for example, on your knee. You're icing and you're putting pressure or compression at the same time, which will help. And then lastly, elevating the area helps to treat swelling. So put your injured area up on a pillow. The injured area should be at a level above your heart as much as possible throughout the day until the swelling is under control. So when is it important to see a doctor? If you cannot control the pain or the swelling with your self-treatment, and maybe even some over-the-counter medications, then it's time to see your doctor. There may be more going on than meets the eye, and it's better to know what you're dealing with and to start the necessary treatment than to wait and do more damage. And ultimately, this will make your return to exercise or your sport quicker, rather than if you ignore something. You may need an X-ray or an MRI so that the doctor can get a better look at the bones or the soft tissues in that injured area. Now, these are the guidelines for safe return to activity. Okay, these guidelines are good to help you decide if you're doing too much too soon, and ultimately to determine if you're ready to return to your activity or your sport. So do not return to your activity or sport unless you are pain-free. If it still hurts, don't use it. If you have no swelling, you can return, but if you do have swelling, that's still a sign of inflammation and something going on, healing still happening. You should have full range of motion, meaning compared to the uninjured area on the opposite side of your body. So if we're talking about an ankle, if you compare your range of motion from your injured ankle to your uninjured ankle, they should match. If you don't have full range of motion, don't return to your activity yet. You should have full or close to 90% of your strength. Again, compare that with your uninjured side. For lower body injuries, you should be able to perform full weight bearing on injured, hips, knees, ankles without limping. If you're limping, you're not ready to return to your sport. If you have any altered gait, in other words, you're able to walk, but it's not, maybe you're walking with a hitch, or it's not proper walking, that can lead to further pain and further injuries to other areas of your body. So for example, if you have an injured knee and when you walk with a limp, that can affect your hips, back, other joints up the kinetic chain. So for upper body injuries, you should be able to perform a throwing or an overhead movement with proper form and no pain. So if you have not met these general guidelines, it's really best to continue your self-treatment or whatever treatment was recommended by your doctor or your physical therapist. Keep in mind that these are only guidelines and that you should follow your athletic trainer or your physician's advice, especially when we're returning to competitive sports. Keep in mind that even when you feel 100%, you may still have deficits in strength and joint stability and flexibility or skill. So it's really important to take extra care with your injured area for several months. So let's talk a little bit about staying active during your injury. So for most isolated injuries, it is still possible to remain active while you're recovering. You will want to do activities that don't affect your injured area, unless you are in physical therapy or working with an athletic trainer and you've been prescribed specific exercises or stretches to do for that area. So to maintain your cardiovascular fitness, here's some ideas for different scenarios. If you have an upper body injury, then lower extremity cardiovascular exercises such as walking, biking, jogging, hiking, those can be used to keep up your cardiovascular fitness. You can use a treadmill, an elliptical, a bike, whatever. Just keep in mind that, some upper body injuries, if you decide to run, the pounding or jarring of that joint can cause pain. So if that's the case, then you'll want to find a cardiovascular exercise that's low or no impact that you can do more like a bike or an elliptical rather than running. If you have a lower extremity injury, then upper extremity cardiovascular exercises can usually be done. So one way is to include low weight, high repetition, upper body muscle conditioning. So, do exercises for your shoulders, your chest, your arms, with no rest in between. So you'll want to be able to do a lot of repetitions with a low amount of weight and don't rest between sets. Just move from one to the next, to the next, to the next. So the equipment you would need is some light weights, or even they make what's called an upper body ergometer, which is basically a bike with pedals, but for your arms. So you would be holding the pedals and pedaling the ergometer with your arms. So you can, do that type of motion for cardiovascular exercise as you would do with a bike with your legs. Also, swimming is a really good full body workout that's easy on the joints. So if you have a joint injury and you're not yet full weight bearing, or bearing your full weight is still painful, the buoyancy in a pool can make you partial weight bearing, but be sure this is cleared by your doctor, and be sure that any cuts or incisions are healed before getting in the pool. You don't want to risk an infection. Now, for continuing muscle conditioning, if you have an upper extremity injury, focus on lower extremity strengthening or strengthening areas of your upper body that aren't affected by the injury. One thing to be aware of when you do muscle conditioning is that even the opposing muscles are involved in a motion. So, for example, if you have a tricep injury, you should probably not do bicep exercises. That's the opposing muscle, because the triceps will be stretched when you do the bicep curl, and also will try to stabilize the arm for your biceps to be able to work. So any affected areas, only do what's prescribed by your athletic trainer or physical therapist, and don't do any exercises that cause your injured area pain. And lastly, muscle flexibility is oftentimes something that's ignored or minimized in workouts. And maintaining muscle flexibility and pliability can reduce the risk of future injuries. So if you can admit that you don't do enough stretching, then what a better time to work on improving your flexibility than when you're out with an injury. For the affected area, only do what's prescribed, but for the unaffected areas, try one stretch for each muscle group and holding it 15 to 30 seconds, and then repeat it 3 times, and do these daily. And, you know, if one stretching exercise is not enough, then maybe start adding another one for each body group, body part. But maintaining and even increasing your flexibility is very important for injury prevention. Now, diet can actually be an important part of your recovery. What you eat after an injury can help you recover from surgery, heal wounds, strengthen bones and muscles, and help you get back on your feet quicker. Typically, with an injury, you're less active, so you might require fewer total calories. To be sure that you, be sure that you make this adjustment as needed. You should eat less than you did when you were exercising or training hard. However, you still need an adequate amount of calories to recover from an injury. So you should eat more than you would if you were completely sedentary. So one thing, protein is important. Injury repair requires more protein. One should increase protein intake from the usual 0.8 grams per kilogram of body weight to 1.5 grams per kilogram of body weight. Injured athletes should aim for 1.5 to 2 grams per kilogram of body weight. So just to give you an idea of this, I'll do the math for you. To convert your weight from pounds to kilograms, divide your weight in pounds by 2.2, then multiply this number by 1.5 and 2 to give you your protein need range. So a 200-pound person is about 91 kilograms and would require between 136 and 182 grams of protein a day. Now, this slide shows some foods that provide about 25 grams of protein, just as an example. But focusing on high-quality protein foods that contain all of the essential amino acids aids wound healing and keeps your immune system strong. If you've had orthopedic surgery, it's normal for your appetite to be depressed. So eat a small amount of protein at snack time and with a meal. Eggs, low-fat cheese, cottage cheese, yogurt, plain baked chicken are all good sources and provide quality protein and are usually well tolerated in the early days after an injury or surgery. Healthy fats are also important. Add healthy fats such as avocados, olive oil, mixed nuts into your diet daily, and aim for more omega-3s from food sources such as salmon, flax seeds, and walnuts. Omega-3s are the good healthy fats that help aid in recovery, but also help reduce inflammation. And it's equally important then to limit your intake of omega-6 fats, which are like canola oil, vegetable oils, corn oils, saturated fats, and other unhealthy fats such as trans fats, because these fats can cause inflammation. Now, vitamin C and zinc are nutrients that are important in healing. Vitamin C and zinc, they're superstars for roles in healing. Vitamin C is needed to make protein called collagen, and is needed for repairing tendons, ligaments, for healing after surgery. Citrus fruits are high in vitamin C, however, also so are strawberries, kiwi, baked potatoes, broccoli, bell peppers. Zinc is a mineral found mostly in animal foods, so meat, fish, poultry, and dairy, but it's also present in whole grains, whole grain breads and cereals, dried beans and peas, and nuts. And then finally, fiber is especially important if you are on any kind of pain meds, because commonly prescribed pain meds after an injury or surgery can cause constipation. Prunes or prune juice, along with drinking plenty of water, have a natural laxative effect that can alleviate constipation while on the pain medications. Now, so I just want to talk briefly about basic walking programs for someone who's a beginner and maybe not an athlete, but is injured and still wants to remain active. This 6-week beginner walking program is on the American Heart Association page at www.heart.org. I'm not going to spend too much time on it, but basically, your first week you would start walking for 20 minutes, 3 to 5 times a week. Each week you would add 5 minutes to tolerance. But so that's just a basic walking program. Next, I want to go into a little more deeply a sample return to running program. And again, this is just a sample, and this is from irwinarmy.mil. And I chose this one because it's a little more basic than some other return to running programs you might see, which might include plyometric exercises. But anyway, so this return to running program, again, keep in mind, you should have no swelling, no pain, etc. Okay. Week 1, you would walk for 4 minutes, jog for 2 minutes, do that 5 times. You'll have a workout of 30 minutes. And then week 2, you would walk for 3 minutes, jog for 3 minutes, do that for 5 repetitions. Again, another 30-minute workout. Week 3, so each week you're decreasing your walking time and increasing your jogging time. Anyway, so this is just one example. Some return to run programs may incorporate plyometric exercises, and they're okay if you already have a good base of strength, but should be avoided if you've never done them before. And that's like jumping, bounding, jumping on and off boxes and different things like that. I do recommend them under the supervision of a certified athletic trainer or a physical therapist only after, after an injury, if it's part of your therapy, unless you're really familiar with them and have done them before. As far as return to lifting goes, with any and all injuries, use, rest, ice, compression, elevation, and make sure that you're treating the swelling. We went over this, but once this is all under control, you can add some range of motion. Basically, all range of motion is moving your joint through its full flexion and extension, or in any motions that it typically can move. And, evaluate if you, again, to your left side and your right side, if one side is more mobile than the other, continue those range of motion exercises to improve your motion. And only move as far as your pain allows. If it hurts, you're not ready. Focus then on flexibility to regain any lost or improve flexibility wherever needed. And then to start working on the muscle to avoid loss of muscle mass, you can first use what's called an isometric contraction. Now, an isometric contraction is one that results in no joint movement. So think about, squeezing your muscle tight, whether it be your arm or your leg muscles, but not moving your arm or your leg. That's an isometric contraction. After a few weeks, you can then start to add some light weights through your full range of motion once you have your full range of motion back. And really stay below 50% of your 1 rep max during this time. And then after about 2 months or longer, depending on the severity of your injury, you can start to add more weight. And keep in mind that whatever your pre-injury 1 rep max was, is not going to be your current 1 rep max. So when you return to your program, slowly add weight each week to build back up at a rate of about 10% of weight each week to tolerance. And then you can add in some closed chain multi-joint movements and continue with slow controlled movements and light weights. So avoid adding any explosive movements unless you have regained all of your strength on the injured side, or at least 90% of your uninjured side. And then remember to continue your work to work your unaffected areas as well and regularly, as long as none of the motions affect your injured area. Okay? Now, how can you speed your recovery time in the future? Okay, so one thing is, hopefully you won't get injured again, but if you do, here's some tips. Stay in shape year-round. Have a well-balanced training regimen that doesn't ignore any areas. Include cardiovascular exercise, muscle conditioning for all body parts, and stretching. Heed any injury warning signs. If something doesn't feel right, investigate it right away. The earlier you catch an injury, the quicker the healing and return to your activity. Treat your injuries immediately. If self-treatment isn't working, seek professional advice. Complete any prescribed rehab program you may have been prescribed. Complete the entire program and follow the instructions of your therapist. Staying fit while injured is best way to return quickly. So while you may not be able to work the injured area, work all areas that are unaffected by the injury to maintain your strength, your flexibility, and speed up your return to play. And finally, stay positive. Having a positive attitude really does go a long way in helping you to heal quickly. Keep an upbeat attitude for your best recovery time. So that's all I have for today. I want to thank you for taking time from your day to attend this webinar. I do want to remind you that My Pathway to Health has many different interactive tools and educational materials available for you. Remember that your health coach is available to help you with any health goals or concerns you may have. You can contact us through the 800 number on this screen or through secure messaging on My Pathway to Health. And we look forward to assisting you with your health goals, and you can view this in all webinars. We do post the recordings on our Orthus Health YouTube site, formerly Strategic Health Services YouTube site. And this now concludes this month's webinar. Thank you so much for joining, and have a healthy day.